Hi, I'm Dr. Bradley Tompkins, a highly qualified and experienced GP. I'm registered, regulated and fully insured and perform prompt, affordable earwax clearance treatment at my modern, independent high street clinic in Fishponds, Bristol. When ears get blocked up, it can be an urgent and unpleasant problem for people. The most common reason for the sensation of blocked ears is an inappropriate accumulation of earwax. The presence of excess wax blocks the transmission of sound waves through the ear canal to the eardrum, so hearing is reduced. There may also be an uncomfortable sensation of fullness and/or irritation in the ear canal. Earwax has an important natural function in the ear canal of keeping the skin moist and reducing the risk of infections. The ears should never be cleaned by inserting cotton buds. Those may come out looking pretty dirty, but the principal outcome is actually to compact any wax deeper in the ear canal, where it's likely to harden over time, causing obstruction that can ultimately be difficult to remove. Now, NHS GP surgeries used to offer ear syringing to their patients as a means of clearing the ear wax that's blocking the canal. This required the practice nurse to take some time out of other important duties to perform the syringing procedure, which involves blindly squirting water into the ear in a bid to hopefully dislodge it. Now, apart from the fact that some patients don't like ear syringing, since the 2007 credit crunch crisis and the reduction in NHS funding, many surgeries have simply stopped offering ear syringing altogether and instead advise patients to try using an ear bulb syringe on themselves at home or to seek a private provider for MicroSuction, whilst they instead deploy their nurses on activities that are either more pressing or more profitable for the practice. Now, my preferred method of earwax clearance is MicroSuction. I developed a proficiency in ear MicroSuction as a junior doctor working in an ENT specialist department in London. MicroSuction involves me using specialised lighting and visual magnification equipment to manually guide a thin suction probe into the ear canal to carefully suck out stubborn earwax under my direct visualisation. This is a pretty comfortable and a very effective procedure, and it's got a very good safety profile too. And I can typically clear both ears in under 10 to 15 minutes if they've been well prepared in advance. Before coming to see me for ear MicroSuction, because your ear feels blocked up, I do recommend that you visit your GP first if you can get a timely appointment. They can examine your ears and confirm whether or not earwax is the problem. Sometimes the cause is not earwax at all, but instead a common cold or a blocked eustachian tube, neither of which are something that MicroSuction can treat, and nothing that eardrops can treat, but should be left to resolve naturally. But if you can't get a timely appointment with your GP, you might want to arrange a private consultation and ear examination with me first instead. Before attending my clinic to receive MicroSuction treatment, I strongly advise you to apply olive oil drops to your affected ear 3 times a day for a full 2 weeks in order to soften the wax up. Earwax blocking the ear canal has often solidified to such a state that it's impossible to remove it otherwise. Now, you can use any shop purchased standard olive oil from your local grocery store for the purpose of softening up your earwax. Just obtain a small teat pipette from your local pharmacy and apply the olive oil by laying on your side and using that teat pipette to administer a few drops into your ear canal. Lay on your side with the treated ear uppermost for 5 minutes to allow that wax to be absorbed deeply. Consider massaging the lumpy bit of your ear, the tragus, to help to enhance the penetration and absorption of the earwax. When you've finished after the 5 minutes, hold some tissue over the ear and sit up to catch any excess olive oil leaking out, and repeat if necessary on the other ear if that's blocked as well. Some people who are prone to suffer with blocked ear canals book with me 2 or 3 times a year for regular MicroSuction to keep their ears clear and avoid the discomfort and inconvenience of allowing it to build up and cause problems for weeks on end again before they can get an appointment. So as you've heard, ear MicroSuction is a safe and effective way to remove soft earwax from the ear canal. To learn more about this treatment, please click the link to the relevant webpage in the video description below. But if you're ready to book with me for your initial consultation, please call my secretary now on 07588 971 425, and I'll look forward to welcoming you to my laser and cosmetic clinic very soon to clear your ears of wax and help you on your way again.